One of the most common yet often overlooked sources of sciatic discomfort after the age of 50 lies deep within the muscles of the hip. The human body is an intricate structure where nerves, muscles, and joints coexist in very close proximity, and even small changes in muscle tension can influence how nerves behave. Among the muscles surrounding the hip, there is one small but remarkably influential muscle called the piriformis. Though modest in size, it sits in a critical location beneath the gluteal muscles and very close to the pathway of the sciatic nerve. In some individuals, the nerve even passes directly through this muscle. Because of this intimate relationship, any tightness or irritation within the piriformis can create pressure on the nerve, producing sensations that travel down the leg. What begins as a mild tightness in the hip can gradually transform into the familiar, radiating discomfort associated with sciatic pain. As people move through midlife and beyond, the hips often become less mobile due to long periods of sitting, reduced physical activity, or simple changes in posture. The body adapts to the positions it spends the most time in, and sitting tends to keep the hips in a flexed position for many hours each day. Over time, this can cause certain muscles around the hip to shorten and tighten, including the piriformis and surrounding deep rotator muscles. When these tissues lose their flexibility, they may begin to pull slightly on the structures around them. Because the sciatic nerve travels so closely through this region, even small changes in muscle tension can influence how comfortably the nerve is able to glide within the surrounding tissues. A gentle seated figure for stretch provides a thoughtful way to address this tension. The movement itself is calm and controlled, yet it engages some of the most important muscles around the hip. Sitting upright in a chair, one ankle is placed across the opposite knee, forming a shape that resembles the number 4. This position naturally opens the hip joint and begins to lengthen the muscles deep within the pelvis. As the upper body leans forward slightly while keeping the spine long, the stretch gradually deepens. There is no need for force or sudden motion. The body responds best when the stretch is slow and patient, allowing the nervous system to recognize the movement as safe. Inside the tissues, several important processes begin to unfold. As the muscle lengthens, specialized receptors within the muscle fibers send signals to the brain indicating that the muscle is being stretched. In response, the nervous system allows the muscle to relax more fully, reducing protective tension that may have developed over time. Blood circulation in the area increases, delivering oxygen and nutrients that help restore the health of the surrounding tissues. This gentle improvement in circulation also helps remove metabolic waste products that can accumulate in tight muscles. At the same time, the sciatic nerve benefits from the increased space created by the relaxing muscles. Nerves are designed to glide smoothly between tissues as the body moves. When surrounding muscles are tight, this gliding motion can become restricted. By releasing tension in the deep hip muscles, the nerve regains some of its natural freedom to move without irritation. Over time, the body begins to experience a subtle but meaningful shift as the hips become more open. The surrounding muscles grow more flexible, and the nerve pathway feels less confined within the structures that support it. Another important dimension of sciatic discomfort often begins within the architecture of the lower spine itself. The lumbar spine is a remarkable structure designed to carry the weight of the upper body while still allowing us to bend, twist, and move freely. 5 strong vertebrae form this portion of the spine, separated by soft, resilient discs that act as cushions and shock absorbers. Between each vertebra, small openings allow nerves to exit the spinal column and travel outward toward the hips and legs. The sciatic nerve, which ultimately carries signals down the back of the leg, originates from several of these nerve roots in the lower spine. Because of this delicate arrangement, even small changes in spinal alignment or muscle tension can influence how comfortably those nerves function. As the years pass, daily habits begin to shape the spine in subtle ways. Long hours spent sitting, leaning forward over desks or devices, or remaining in one position for extended periods can gradually place extra pressure on the lower back. When the spine stays compressed for too long, the muscles surrounding it may tighten in an effort to protect the joints. This protective response is natural, but it can also reduce the space available for the nerves emerging from the spinal column. When a nerve becomes irritated in this environment, the sensation may not remain localized in the back. Instead, the signal travels along the length of the nerve pathway, often producing the familiar radiating discomfort that extends into the hip or leg. A gentle knit-to chest movement offers a surprisingly effective way to relieve this pressure while encouraging the spine to move in a safe and controlled manner. When lying on the back and slowly bringing one knee toward the chest, the lower spine begins to round slightly against the surface beneath it. This motion creates a mild flexion of the lumbar region, which can help widen the spaces between the vertebrae for a brief moment. Why? In that moment, the surrounding joints experience a sense of decompression. Muscles that were previously holding the spine in a guarded position begin to relax, and the pressure surrounding the nerve roots may gently decrease. From a physiological perspective, this movement also stimulates the soft tissues that support the spine. As the knee moves toward the chest, the muscles along the lower back and hips gradually lengthen. Stretch receptors within those muscles communicate with the nervous system, signaling that the tissue is safely extending. In response, the brain allows the muscles to release some of their protective tension. This process is not dramatic or sudden, but rather subtle and progressive. Each repetition encourages the tissues to relax a little more, allowing the spine to rediscover a comfortable range of motion. Breathing also plays an important role in this movement. As the knee is drawn gently toward the chest and the body relaxes into the floor, slow breathing encourages the nervous system to shift toward a calmer state. The body's stress response begins to quiet, and muscles that were unconsciously guarding the spine may release further. This combination of spinal movement, muscle relaxation, and steady breathing creates an environment where irritated nerves have the opportunity to settle. With regular practice, this simple action can gradually restore mobility to the lower spine. The joints begin to move with greater ease, muscles regain their flexibility, and the nervous system becomes less reactive to everyday movements. What begins as a modest exercise becomes a gentle reminder to the body that the spine is capable of movement, adaptation, and relief when given the right signals through thoughtful motion. Relief from sciatic discomfort is not achieved through stretching alone. Equally critical is the development of stability in the core and pelvic muscles, which serve as the body's natural support system for the lower spine. As people age, it is common for these muscles to weaken, especially when long periods of sitting reduce their regular engagement. When the deep abdominal muscles and pelvic stabilizers lose strength, the lower back is forced to compensate. This compensation can place excessive strain on the lumbar vertebrae and the surrounding ligaments, which may increase pressure on the nerve roots, contributing to sciatic pain. Strengthening these muscles is not about building visible bulk or performing strenuous exercise. It is about restoring the body's internal scaffolding so that the spine and pelvis can move efficiently and safely. A simple yet effective way to reawaken these stabilizing muscles is through a controlled pelvic tilt. The movement begins with lying on the back, knees bent, and feet resting firmly on the floor. With attention to breathing and posture, the pelvis is slowly tilted upward, pressing the lower back lightly into the floor, then return to a neutral position. Although the motion is subtle, the engagement is significant. The deep abdominal muscles, often overlooked in everyday movements, contract to stabilize the pelvis. These muscles act like a corset, supporting the spine from the inside. At the same time, the gluteal muscles assist in maintaining proper alignment of the hips, while small muscles along the lower back coordinate to prevent unnecessary strain. Together, this gentle engagement creates a balance between flexibility and support, allowing the lower spine to rest in a more neutral, safe position. The benefits of this movement extend beyond the muscles themselves. By activating the core and pelvic stabilizers, the body begins to redistribute forces that would otherwise be concentrated on the lumbar vertebrae and the sacroiliac joints. Each repetition provides the nervous system with a signal that these muscles are available and capable of providing support. In response, the brain reduces the protective guarding, often triggered by pain, which can further relax surrounding muscles and improve mobility. This gradual recalibration allows the spine to move with less resistance, reducing irritation to the nerves that run through the lower back and down the leg. Another advantage of pelvic tilts lies in their ability to integrate the concept of controlled motion with awareness. When the movement is performed slowly, with attention to the way the spine, pelvis, and core muscles interact, the body begins to retrain itself. It learns to engage the appropriate muscles at the right time, creating a coordinated system of support that extends beyond the exercise itself. Over time, these neuromuscular patterns become more automatic, making daily movements such as standing from a chair, bending, or walking smoother and less likely to aggravate sciatic pain. Breathing also plays an integral role in reinforcing the benefits of this exercise. Slow, deliberate inhalation and exhalation help the nervous system recognize that the movement is safe and controlled. This calming signal further reduces tension in the lower back and encourages the muscles to engage efficiently without unnecessary rigidity. The combination of gentle movement, muscular activation, mindful breathing creates a comprehensive approach to restoring stability, protecting the spine, and alleviating some of the chronic stress that contributes to sciatic discomfort. Over time, the body begins to operate as a more coordinated system, where muscles, nerves, and joints work in harmony rather than in compensation, reducing strain and improving overall comfort. Another critical factor in relieving sciatic discomfort lies in the strength and activation of the gluteal muscles, which form the foundation of the hips and pelvis. These muscles are among the largest and most powerful in the human body, designed to stabilize the pelvis, support the lower back, and generate force for walking, climbing, and rising from a seated position. Yet in modern life, especially for those over 50, the glutes are often underused. Long hours of sitting, combined with reduced daily activity, lead these muscles to become inactive. When the glutes fail to engage properly, smaller muscles around the lower back and hips must compensate, placing additional strain on the lumbar spine and sacroiliac joints. This compensation can contribute to the irritation of the sciatic nerve, perpetuating discomfort and limiting mobility. One of the most effective and accessible ways to reactivate the gluteal muscles is the glute bridge. This exercise begins with lying on the back, knees bent, and feet flat on the floor. The hips are lifted slowly toward the ceiling, forming a straight line from the shoulders to the knees, and then lowered back to the floor with control. Despite its simplicity, this movement engages multiple muscle groups simultaneously. The glutes activate to lift the hips, while the hamstrings assist in maintaining control, and the core muscles stabilize the spine. Even the small stabilizing muscles around the pelvis and lower back engage, creating a coordinated effort that distributes the mechanical load evenly through the posterior chain. From a physiological perspective, the glute bridge offers more than just muscular engagement. By reactivating these powerful muscles, the body begins to redistribute forces that previously concentrated on the lower back. When the glutes are weak, movements like walking or standing from a chair rely excessively on the lumbar muscles and the spine itself, which can compress the nerve roots associated with the sciatic nerve. Strengthening the glutes reduces this undue stress, allowing the spine to function in a more neutral, supported alignment. Over time, the hip extension achieved through the bridge helps restore proper pelvic mechanics, which further alleviates pressure on the sciatic nerve and surrounding structures. Additionally, glute activation enhances neuromuscular coordination, teaching the brain to engage the correct muscles at the right time. Many people develop inefficient movement patterns over decades, often unknowingly relying on the lower back or smaller hip muscles rather than the glutes. Repeating the glute bridge regularly provides the nervous system with consistent feedback that these muscles are available and capable. The brain gradually learns to recruit them more effectively during everyday movements, improving posture, balance, and functional strength. This retraining process is subtle but transformative, allowing the body to move with greater confidence and less risk of aggravating sciatic discomfort. Another key benefit of this exercise is its accessibility and safety. The glute bridge places minimal strain on the joints while providing significant activation to critical muscles. It can be performed anywhere, requires no equipment, and allows the individual to control the range of motion according to their comfort level. Even modest improvements in glute strength can lead to meaningful reductions in lower back strain, enhanced hip stability, and decreased irritation of the sciatic nerve. Over weeks and months, consistent practice gradually restores the foundation of support beneath the pelvis, improving overall alignment and movement efficiency. As the glutes regain strength and coordination, the body experiences a quiet but powerful shift. Movements that once provoked discomfort begin to feel more natural. Posture becomes steadier, and the nervous system can operate without constant protective tension, reducing the cycle of pain and guarding that often accompanies chronic sciatic irritation. Perhaps the most profound insight when addressing sciatic discomfort after 50 is the recognition that the body is not a static machine, but a dynamic system, continuously communicating with itself through muscles, joints, and nerves. Pain is often a signal that the body is out of alignment or that certain muscles have become inactive. It can create a cycle of fear and avoidance. Many individuals begin to move more cautiously, worried that bending, twisting, or standing might exacerbate discomfort. Yet the body is designed for motion, and thoughtful, intentional movement sends the nervous system a message of safety. When exercises are performed mindfully, even simple ones, the muscles, joints, and nerves learn to coordinate more efficiently, gradually reducing irritation and restoring confidence in movement. This principle underscores why consistent, gentle exercise can be more impactful than sporadic, intense activity, particularly for seniors dealing with sciatic discomfort. The nervous system responds not only to the physical forces placed on the body, but also to the quality and awareness of those movements. Slow, deliberate actions allow the brain to interpret sensory feedback as safe and controlled, which in turn reduces the reflexive tension that often surrounds irritated nerves. For instance, when performing exercises like gentle hip stretches, two chest movements, pelvic tilts, or glute bridges, the nervous system registers each controlled motion, recognizing that the tissues are capable of moving without harm. This reassurance encourages the muscles guarding the spine, hips, and pelvis to release, allowing the body to function with less protective rigidity. Over time, this creates an environment where the sciatic nerve can glide freely within its surrounding tissues, reducing the intensity and frequency of discomfort. Another key aspect is the integration of multiple systems working together. Pain relief is rarely achieved through a single movement or an isolated stretch. It requires a combination of flexibility, strength, stability, and neurological engagement. When the deep core muscles, glutes, hip stabilizers, and spinal muscles are all gently activated and coordinated, the body develops a more resilient structure. The spine becomes supported from within, the pelvis moves with greater efficiency, and the nerves have space to function without compression. Each exercise contributes to this system-wide harmony, reinforcing proper alignment and muscular engagement, while retraining the nervous system to interpret movements as safe rather than threatening. Patience is central to this approach because adaptation in the nervous system and musculoskeletal structures takes time. Unlike the immediate relief one might feel from medication or temporary rest, mindful movement provides long-term change by retraining patterns and strengthening the body's support mechanisms. Small, consistent efforts accumulate into meaningful improvements. Muscles regain coordination, joints move through their natural ranges, and the nervous system gradually recalibrates its response to motion. This holistic process addresses both the mechanical and neurological contributors to sciatic discomfort, offering a sustainable path toward relief that honors the body's capacity for adaptation, even later in life. Finally, mindful movement fosters a sense of confidence and awareness. When individuals notice that gentle, deliberate exercises can reduce discomfort, they begin to trust their bodies again. This trust reduces fear-based movement patterns, encourages regular activity, and enhances overall quality of life. The body learns to operate as an integrated system where muscles, nerves, and joints communicate effectively, allowing daily activities to be performed with greater ease and less pain. Over time, this approach not only alleviates sciatic discomfort, but also restores a sense of agency and control over one's own body, cultivating both physical and mental resilience that supports long-term well-being.